Hello, this is Dr. Meg Van Achterberg, and today we will be discussing trauma-informed skills, what you need to know to be a volunteer or an employee of the Traron Center. I would like to thank the Treatment and Services Adaptation Center for Resiliency, Hope, and Wellness in Schools for developing this training and letting us adapt it for the use of the Traron Center. There are 3 goals for this training program. 1, to learn about the different types of traumatic experiences that the kids of the Traron Center may have experienced, and to understand how frequently they occur. 2, to understand how exposure to trauma can impact the development of children, both emotionally, socially, and academically. And 3, to enhance your ability to work and interact supportively with students who've been exposed to trauma. So what is a trauma responsive system? That is a system or an organization where everyone understands that trauma is common and it has a profound impact, where we all understand and recognize the common signs and symptoms of trauma. And we all work together to try to avoid re-traumatizing children and young people by using trauma-informed principles in our work with them. Let's talk about the case of Kamira. Kamira is a child that you're working with at the center. You're playing a game with her and several other children. She thinks another boy named Jarrell went out of turn. He responds by telling her she's a big liar and a crybaby. Her response? Starting to curse, knock the game off the table, and storming away. It's understandable and common for an adult in this situation to feel frustration, anger, annoyance, to respond by scolding Kamira and talking to her about her bad behavior and bad manners. Well, in a trauma-informed system, we want to think about some questions before we respond to her. 1, what could be going on inside of Kamira? What could be going on within the group of kids? What could be going on in this child's family? What could be going on in the neighborhood, in the community, in the school? And what could be going on inside of you? Common words people use to describe child behavior: unmotivated, lazy, oppositional, aggressive, disrespectful. A trauma-responsive system is one where the entire organization or system and all the people involved in it are trying to realize the prevalence and impact of trauma. Please take a minute to read these 2 different definitions of trauma. There are 4 different types of trauma: acute trauma, chronic trauma, complex trauma, and intergenerational trauma. An acute trauma is generally a time-limited event, typically one traumatic event. That does not mean it's not extremely traumatic. An example they give here is a car accident. You could also think about a terrorist attack, a single shooting event, the death of an important loved one, or an acute illness. Chronic trauma is trauma that occurs repeatedly over time. Think about domestic violence or abuse. Recurring community violence would be another example of that. One which is extremely relevant to the children of Traron Center. Complex trauma is a trauma that occurs on various levels within the caregiving system of a child. Such as a child who experiences chronic neglect and then it is moved to a foster home, is physically abused, can't trust many people within the system in which he or she lives. Finally, there is historical or intergenerational trauma, and this is trauma that carries out through many generations based on historical traumatic experiences, genocide, slavery, and ends up being passed from generation to generation. We can see this among Holocaust survivors, Native Americans, and also among the children here at the Traron Center who have lived in many generations of poverty and social disadvantages, with the historical antecedent being the systemic abuse of slavery. Even nationally, a large percentage of children are exposed to trauma or violence of some kind. When we look at these numbers, please remember that for the children who attend the Traron Center, the percentages are even higher. A closer comparison may come from this study done in the LA Unified School District of 6th graders, which found that over 90% had experienced some form of violence. Let's talk about the Adverse Childhood Experiences Study, also known as ACEs. This is a simple questionnaire of 10 difficult situations that children can experience. As you see here, they're grouped in 3 categories: neglect, household challenges, which includes domestic abuse not of the child, parental drug abuse, parental mental illness, and parental divorce or separation, as well as abuse directly of the child. Children or participants or adult participants are simply asked if they have experienced any of these adversities. Here are the results from the ACEs study run by the CDC and Kaiser. They retrospectively asked adults about these 10 adverse childhood experiences. And you can see that the percentages are on the right side of this table. The key findings: more than 25% of people grew up in a household with a parent that abused drugs, 20% had a parent with mental illness, and 25% had experienced physical abuse. 1/6 of the people interviewed had 4 or more ACEs, and the more ACEs you have experienced, the more that correlates with a number of life problems later in your life, which we will discuss further. Take a moment to consider what are the most common traumatic, difficult, or stressful events that occur in the lives of the children of the Traron Center. Now we're going to switch from the prevalence or frequency of these kinds of traumatic events to the impact of various traumatic events on developing children. We know from neuroscience very clearly that severe and chronic stress in childhood leads to brain changes, it leads to bodily changes that affect the way kids develop and the way they function in school. And it would also affect them the way they function here at the Traron Center and in every aspect of their lives. Let's talk about some regions in the brain that are involved in the stress response. We're going to focus on a couple of different relevant regions. We see in orange is the prefrontal cortex. That's the front part of the brain. Sometimes I refer to kids as the quarterback of the brain or the boss of the brain that is in charge of reason and logic and planning the executive functions of being organized and deciding where to focus and what to do first and what's important. In blue is the hippocampus, and that has to do with regulating memories and emotions and processing new memories. And then the oval in the center that's colored green, the amygdala. And this is what some people refer to as the security guard of the brain. This is what's going to trigger our fight and flight response, set off the alarm bells that something dangerous is happening, and help us respond physically to the stressor or the trauma by getting us to breathe faster, revving up our whole system so we can actually fight or fly or flee from the environment. The amygdala is why memories that are traumatic are stored and processed differently than memories that are pleasant or neutral or everyday. In an acute trauma, the functioning of the amygdala is extremely important. If you were suddenly being chased on the street by a tiger who's coming at you and growling, it would be really important for that amygdala to set off alarm bells so that your entire physiological system, all your energy would be devoted to getting you out of there as fast as possible. It would be terrifying and scary, but that is why we have those reactions, in order to get us out of dangerous situations. Here's another example. When we see a snake slithering in the grass, it triggers something very instinctual, and that's through the help of the amygdala. Even though most snakes are not poisonous, there are those that are, and that's a dangerous situation that we need to escape quickly. In a typically functioning brain, we see how this works. The scary event occurs, which causes the amygdala to produce an alarm signal, which overrides the prefrontal cortex, or the thinking part of the brain, and we have a response to that crisis, fight or flight, sometimes called fight, flight, or freeze. The changes that happen in the brain during this are helpful in the immediate state of danger that the person is in. So imagine a few weeks later, you're walking past the lawn and you see a similar winding object in the grass. Before you know it, your heart is racing and you're ready to flee. Only this time, what you thought was a snake because of your previous experience was only a garden hose. We call this a false alarm. You'll see that kids who've experienced traumas will have an abnormally high rate of false alarms, where triggers are misinterpreted as dangerous and react with what we might think of as an over-the-top reaction if we don't consider the context. Let's look at the case of Johnny. 2 weeks ago, he was in a car accident. One day, while sitting in your group, he hears a car skidding down the street and making a screeching sound. Later, you look over and notice that he's very distractible and fidgety in his seat and not paying attention to what you're trying to talk about. Now, this is a good example of an acute trauma, a one-time single trauma. But still, there are consequences for this young person. even weeks later. Now let's talk about kids who are exposed to chronic trauma. Over time, the amygdala is being called into play over and over, and it gets stronger and stronger, whereas the thinking brain, the prefrontal cortex, the hippocampus, those areas are not being brought into play as much, and in a sense are weaker. The metaphor used here is that these parts of the brain are like a muscle, whereas the fight or flight response, the security guard is getting stronger and stronger, and the wiser parts of the brain are weaker. Another metaphor could be a path in the woods. If you have a forest and you start taking one particular route through the forest, if you do so over and over again, there becomes a path. And then that's a path that you're more likely to take over and over and over again because it's well-worn and trodden. And it's harder to go a different way because the weeds grow up and you have to fight harder to push through the brush or undergrowth in the woods. Let's take the case of Shonda. Shonda was placed in foster care after witnessing domestic violence in her home. You notice that she seems on edge. She is constantly nervous and fidgeting. These behaviors become worse when she hears loud noises such as a door slamming or people shouting. You've also noticed that Shonda has a hard time concentrating. While some kids might be a little bit nervous about speaking in a group, she becomes extremely stressed with her speeding up and shaking. Here's a PET scan of the brain. The left is the healthy brain. The right is the brain of someone who has experienced abuse and trauma. In this particular kind of scan, it actually measures blood flow through certain areas of the brain, and the more blood flow, the more active those areas of the brain are. So the most active areas are red and then yellow, whereas green and purple and black are the least active areas of the brain. You'll see that the healthy brain has a lot more activity in the prefrontal cortex, that's at the top, in the temporal lobes, which also contains the hippocampus, than the abused or traumatized brain does. So now that we recognize that trauma can change and affect the brain, let's talk about how we recognize the types of behaviors that those brain changes can cause and how they might manifest in the kids that we see at the Traron Center. We will divide the types of trauma symptoms into 4 categories. The cognitive, which is also mental, decision-making, planning, executive functioning, that is controlled by the prefrontal cortex, the front part of the brain. The emotional symptoms, the behavioral symptoms, and the physical symptoms. Cognitive symptoms can include problems with concentration, problems with organization, such as difficulty with time management and difficulty following instruction. Problems with memory may also occur. Difficulty recalling previously learned information, difficulty memorizing things, difficulty even with finding words. Chronic exposure to trauma can lead to cognitive distortions, which are extreme thoughts, exaggerated thoughts, or thoughts based on incomplete information. For example, a child might think, I can't handle this situation, no one cares about me, I'm a bad person, I'm powerless, or life is meaningless. In summary, there are many ways that trauma can impair someone's cognitive functioning. And as you press through these items, think about how each of these areas of difficulty may affect a child that you're attempting to work with. Thanks to the impact of trauma on the hippocampus, which is in charge of memory, along with the prefrontal cortex, many emotional symptoms can occur in those who've been exposed to trauma. Anxiety, depression, and the classic symptoms of post-traumatic stress disorder can be common. Post-traumatic stress disorder, or PTSD, can result in a person re-experiencing trauma in various ways through classic flashbacks, nightmares, or just intrusive memories getting in the way of their day. Children or adults with PTSD can avoid certain triggers that remind them of the trauma, or certain places that remind them of the trauma, can avoid accessing their emotions, and they can also be hypervigilant, when that means jumpy, quick to react, startled easily by loud noises or other triggers. Anxiety commonly manifests in children as worrying about a number of things, especially about the health and safety of their family members, or fears of being separated from family members. Excessive doubt, physical restlessness, sense of dread or fear of the future. Stomach aches or headaches are common, especially in smaller children. As mentioned before, post-traumatic stress disorder can manifest with intrusive and distressing thoughts, avoiding people, places, and things that remind the victim of the trauma, being very jumpy or restless, agitated, and of note in younger children, reenacting part of their trauma, acting it out, can be seen. Here are some of the symptoms of depression. Feelings of hopelessness, loss of interest in things that you used to enjoy, fatigue, getting agitated or irritable, that's especially true in younger children, and feelings of worthlessness and guilt, trouble with motivation. Common behavioral symptoms that you may see. One side of the coin is acting out, overreacting to seemingly typical circumstances or small perceived offenses, being jumpy with loud noises or other stimuli, and aggressive behaviors. And we see a lot of this kind of acting out in the kids of Traron. Also shutting down, not engaging with family and friends, shutting people out, withdrawing from the typical routine or things that interest them. Again, we see these symptoms as well. Physical symptoms are very common, especially in younger children, in reaction to stress. You may see fatigue or frequent tiredness, headaches or stomach aches, and medical conditions that the children already have being exacerbated. Asthma is a common one that we see in this population, and anxiety can certainly exacerbate or even lead to asthma attacks. The causative reason is that stress can affect people's inflammatory systems, exacerbating inflammation. And another interesting finding is that pain and mood are often mediated through very similar systems, so that they can each exacerbate the other set of problems. I mentioned the adverse childhood experiences, or ACEs, measure earlier. This is another place where it becomes extremely correlated. The percentage of children with academic problems at school, is pretty directly correlated with the number of adverse events that they have experienced in their lives. Here's a different study and a different type of graph, but it says essentially the same thing. That the more ACEs, the more academic and behavioral problems that are seen. So how we want to see these children is to shift our perspective from what is wrong with this child to what has happened to this child. So let's shift into the very important discussion of how to respond to these children's strategies that you can use while working at the Traron Center. We're going to talk about 4 areas, general areas where we can focus our efforts. One is resilience and relationship building with the child. Second is creating a positive climate. The third is trauma-informed communication. The fourth is trauma-informed de-escalation once a problem has already started. Children are amazing in their ability to be resilient, to bounce back, to struggle and learn, like this little flower growing in the asphalt. You will find some beautiful and inspiring examples of that here at the Traron Center. And we absolutely want to take and build off of that strength that comes naturally to many children. Why do some kids do relatively well and bounce back from terrible situations where others struggle and really never gain their bearings again? We can look at some protective factors, and research has actually shown that these factors can help protect a child from difficult situations. Their personal assets, such as intelligence, their talents, perhaps athletic or artistic, their temperament, very easygoing, loving child, naturally by temperament, may have an easier time, and their own sense of self-esteem and self-worth. There are other resources around them. Relationship with a trusted adult. We see here our own wonderful Miss Wiggins interacting with many of the children. Consistent and predictable roles, routines, and rituals that adults or others around them have been able to put in place, and being given a sense of purpose, developing a sense of purpose in their lives. While all of these protective factors are extremely important, a positive relationship to an adult has been shown to be the most protective factor of all in children's lives. It can serve as an antidote to trauma to some extent. It communicates to kids that they are safe and that they belong in the community. It can help resculpt their brain architecture by helping children turn down their survival brain and return to the more prefrontal cortex areas in making decisions. It can model safe and trusting relationships for a child. So here again is the image of the brain, and as you see, the amygdala can be, in a sense, calmed and turned down so that the survival response doesn't kick in by a relationship with a trusted adult, and enhancing the areas of the prefrontal cortex and the hippocampus. So the first step in having a relationship with a traumatized child that is healthy and trauma-informed is to make sure that the child is safe. Clearly, physical safety is of the utmost importance, and if you ever find yourself feeling that you may lose control and be unsafe in any way, please immediately stop working with that child and seek the help of a supervisor in that situation. We also want to ensure that the children feel psychologically safe, supported. We want to avoid any repeat of emotional abuse, putting down the child, insulting the child, marginalizing the child. We want to model calm behavior, keep our voices well modulated, avoid yelling, avoid empty threats. Really take a moment to pause when a child is testing you and think how you can proceed, and just show them how a calm person, a person who can implement self-control, can behave in a challenging situation. Consistency and predictability are very key for our children. We want to have a consistent, predictable schedule as much as possible for the children. You may be coming in for a one-time or short-term work with the child or children. And it's important to let them know right up front what the plan will be, how things will proceed. And if you're working repeatedly with them, let them know if there are changes to the routine or schedule. That's very important to help them remain calm and in control of their anxieties. If you promise something, it is very important to follow through with this. And I would caution you not to promise things that you may not be able to follow through on. We talked earlier about the impact of generational trauma and cultural trauma on children, and that's why cultural sensitivity is very important. It's also important to understand the cultures that the children live in now. Be aware of your own biases, and seek knowledge and training from both from the children themselves to teach you about the culture that they live in, and also from the staff who may have more experience. Let's talk about empowerment. This can be an extremely powerful tool to help children feel more in control of their lives. Exposure to trauma typically causes feelings of helplessness and vulnerability, and that you have no control over things that can happen. Providing opportunities for children to take charge, to make decisions, to come up with projects that they think can help improve their lives and their neighborhoods. I also want to stress the importance of helping others. Perhaps leading children or helping children facilitate a project that is going to help someone else in their neighborhood. Those feelings are incredibly powerful and actually healing. Please pause to acknowledge the successes that each child has come up with. Please encourage children to draw on their own resources. Even small children have different interests and skill sets, and they love to be experts and bring something unique to the table. So find any opportunity you can to facilitate that. What kind of environment or climate would we consider trauma responsive? Well, we'll talk about that in the next couple slides. All children need safe and calm environments to learn and grow to be their best, but this is especially true with kids who've experienced trauma. Both the subject matter The materials in the room and the environment of the room are important. Schedules are important. Whether you're coming for one time a visit or for a weekly or monthly event, please let the kids know what to expect. Posting the schedule can be extremely valuable. The more ways that the children can take in the information, the more likely it is it will reach most kids. And if there's a disruption to the schedule, let them know what's going to happen. Please carefully consider the subject matter that you're bringing in to the children of the Traron Center. Be aware of potentially triggering materials, signs, and the subject matter that you talk about. For our kids, you really want to think carefully about what you talk about, the kinds of games that you choose. We certainly don't want to introduce any games that involve shooting or violence, and that even goes for water guns and the like. In fact, we have found that non-competitive and cooperative games really foster the kind of relationships and community that we want at the Traron Center. Much better than straight up competitive games. There may be stimuli outside or around the environment that you're in that you cannot control, but be aware of them and how the children might react to them. Think about the sounds of police sirens, car alarms, fights outside the window, even potentially gunshots. Obviously, you want to maintain safety. Consider closing the window, moving the children away from the area of noise, and finding other activities to engage in. And also be looking for signs that the children are triggered. It may actually lead to a conversation about triggers and how our physical bodies can react to that. Let's talk about setting expectations for how children are going to interact with each other. We want to make it clear that we want to foster collaboration and create a culture of support. Peer-to-peer support can be one of the most healing experiences following a trauma. And students should be supported in helping one another talk about their feelings, understand that feelings are safe, that they don't tease each other about that they listen to each other. You should be aware of conflicts between certain students and think about who gets grouped together and how to resolve conflict between two groups. Finally, a child who is emotionally upset or dysregulated may lead others to become emotionally upset and dysregulated. It's important to give a child who is experiencing such emotional dysregulation time to calm down, a safe place to do so. Think about the interactions that you're having with the children one-to-one. Involve children in the ability to make decisions to foster their own empowerment. Think about the physical space when you're standing next to children or near children. Some children may not be comfortable with having an adult stand very close to them or stand over them. That may feel intimidating. It's often best with younger children to crouch down to their level and look directly into their eyes and make eye contact and when speaking with them. Think of the tone of voice when you're communicating with children. Is your tone angry, harsh, anxious, or is it calm, respectful, patient? Are you giving the child the time they need when talking to them to understand what you're saying and to think about how he or she wants to respond or react? Tone becomes even more important when a child is upset or dysregulated. Sometimes it's said the louder or more out of control the child's voice gets, the calmer, lower, deeper, firmer, but more in control your voice needs to get. Adults often make the mistake of yelling and screaming to be heard over children when going close to them, coming to their level, and speaking in a low but clear and firm voice, as slow as you need to take the time to do so, shows that you are in control of your own emotions and calm and in control about the situation. Calm areas in the room can be very important. These calm areas are places that children can go to take a break, separate from someone they're having conflict with, and use their senses to engage all areas of their brains in order to calm their amygdalas and deactivate the flight or fight response. We find that Play-Doh, fidget toys, stress balls, music, slime, these things can help children to center themselves. We also find that sometimes quiet reading can be helpful. Please ask about where the calm areas at the Traron Center can be found. Also, it's important not to use these calm areas as a timeout or disciplinary area, and instead of forcibly sending someone there as a punishment, to say, looks like you're having a hard time. How about we walk to the calm area? Or let's walk to the calm area. Pull out some Play-Doh. Start talking to the child in calm tones while you both play with Play-Doh. Or let them choose to go there on their own to de-escalate a situation. Let's talk a little bit more about the kind of communication that we want to foster at the Traron Center when working with the kids. Before we talk about what to say to children, let's quickly review some aspects of how you talk with children, which in many ways is even more important than what you say. So let's talk about tone. You want your tone to be calm and neutral. Avoid speaking to them in an authoritarian tone, which could be seen as aggressive and harsh. Children generally don't understand sarcasm, and this can be seen as minimizing or belittling. A quiet tone is preferred. Speaking too loudly may be a trigger for some children who've witnessed intense arguments. Try to speak in an even and steady pace, not too rapidly. And maintain eye contact. It's a good way of letting children know you're listening. You don't want to loom over children, but actually get down on their level, crouch down, and speak to them
on their level. One way I like to think about this is think about Mr. Rogers and how, if you ever saw him speaking to children, that tone, that physical presence, that eye contact. It works for all children, but it's especially important for children who've been traumatized. We're going to talk about different ways to show that you're attuned to the child and his or her feelings. Validation, simple reflections, reflections of feeling, and double-sided reflections. Let's say a little bit more about each strategy. Again, the affirmations are statements that just recognize, acknowledge the person, encourage them and their feelings. Here's some examples. I know there's a lot going on. I'm glad for you that you are here today. You're doing a great job. You seem to work really hard on that. Again, you have chosen to play this game or do this project. Even simple things like that can tell the child that you acknowledge his or her presence and the essence of him or herself. A simple reflection is simply repeating a feeling that the child has stated back to them. I just want to leave today. Everyone's on my case. One response, it's hard for you to stay here today. Another response, everybody is really on you today. This shows you acknowledge the child's feelings and you accept them. Reflection of feeling is more complicated. It is reflecting back what you perceive the child is feeling based on what he or she has said or how they're acting. In the same example, I just really want to leave today. Everyone's on my case. You might say, you seem really frustrated today. Or, you're feeling overwhelmed. This shows that you have not only seen what they're saying, but gone deeper into how they're feeling. Now, you may be wrong. You may have a child who says, that's not what I'm feeling. And that's okay. That does not mean that you have lost his or her trust. And then you say, okay, I guess I got it wrong. What are you feeling? And, follow their lead on that. But generally, children may not be aware of what they're feeling when they are overwhelmed, angry, and frustrated. And, there's a saying, to name it is to tame it. You give them power by naming a feeling. And so they can see that this is a feeling. It comes, it goes. It can pass. And I can do something about it. A double-sided reflection is used when the child expresses confusion or ambivalence about a topic or situation. Using the same example, I really want to leave today, but I know it'll just get me in more trouble. You respond acknowledging the child's ambivalence about his or her feelings. An example of that might be, you're feeling frustrated today, but you know you'll get in trouble if you leave. And this is important in pointing out that the child can have feelings that are in the gray area, that he or she can have two competing feelings and interests. Think back to the different areas of the brain, the prefrontal cortex, which might be driving the understanding that, gee, I might get in trouble if I leave. And the amygdala, which is sending off alarms that I'm feeling frustrated and overwhelmed, get me out of here. That both reside in the child's brain, And by this double-sided reflection, you're acknowledging that fact and helping the child to understand it more.
Here are some common ways of talking to children that actually get in the way of effective communication. Take a minute to look over these. You may actually be surprised to find that some of them are seen as quote-unquote positive ways of talking to children, such as distracting them, changing the subject, or even agreeing or approving or praising. Those can actually shut down communication just as well as things like shaming, threatening, disagreeing, criticizing. There's also some things that you might not think of as problematic, like moralizing and preaching and trying to persuade with logic, that can actually shut down what a child is trying to say and make him or her feel like it's wrong to feel that way or express those points of views. All feelings are okay, and we need to be sure that we're making that clear with children by accepting their feelings as they are. Remember, accepting feelings is not the same as accepting behaviors. Just because we accept an angry feeling and acknowledge that feeling does not mean that we accept or allow the child to be unsafe with other people, with property, or with themselves. Let's talk about the power of normalizing feelings and symptoms for kids. It can be very helpful and empowering to educate a child about common reactions from trauma. Remember to consider the age and the child's understanding of the events. Be aware of common emotional reactions, common behavioral reactions, and common physical reactions that people can have in response to trauma. And share that knowledge with kids as you feel appropriate. Let's give some examples about how you might normalize a reaction or behavior that you see in a child. For example, a child might say, "Sorry I'm late, I didn't sleep last night." And you might say, "Okay, so I'm hearing you're not sleeping well. Just so you know, it's actually pretty common when people who have seen scary things to have trouble sleeping." Obviously, you would only say this if you knew the context that the child had recently experienced something scary or seen something scary like that. Try to find ways to empower children to become experts at their own well-being and mental health. Finding ways that they can identify resources and protective factors as well as their own strengths. Here are some examples. A child who says, "I didn't sleep last night." You can respond, "So, you're telling me you're not sleeping well? Just so you know, people who experience scary things often find it hard to sleep." And here comes the empowerment part. What has been helpful in the past when you've had a hard time sleeping? Another example, "I can't pay attention to this book." Okay, it can be hard to concentrate after you go through something scary. Can you tell me what you think would help it make it easier for you to feel calm? Now we're going to move into the topic of how to de-escalate a situation or a person who is become emotionally out of control or dysregulated, and doing so in a trauma-informed way. The first and most powerful tool, to be honest with you, is to regulate your own emotions and to be in charge and in control of your own emotions. Two people who are both dysregulated cannot have a meaningful conversation. So modeling how to calm yourself can be the most powerful tool of all. So let's only engage the student from a place of calm. If you are not calm, if you're feeling angry or potentially out of control or even violent, please take a moment to step away from the situation, get some help, and ask for advice. being authoritative or punitive can actually worsen the situation and make a child feel more out of control. A child who sees that you are calm knows that even though he or she is out of control, at least this adult here with me is calm and not frightened by the situation. Give yourself a pep talk, especially if you know you may be dealing with a tough situation that particular day. Say, I can handle this. This is not about me. This is about the children and their own issues. You can say to yourself, the child is scared and he or she is testing me to see if I'm scared too and don't know what to do, or if I can stay calm in this situation. Try pausing and grounding yourself in the present environment. Notice all your 5 senses. Count to 10. The example they give here is even remember what date it is. Identify 5 colors in the room. Something to make yourself present and calmer in the moment. Take a deep breath. Try a muscle relaxation exercise. In fact, you can lead the children in a relaxation exercise on the spot if you are feeling a little overwhelmed. Say, I think I really need to do this deep breathing exercise right now because I want to feel calmer and more present in my body. So sit down, start to do the exercise, say, who would like to join me? And lead them in a meditation or a breathing exercise. And as a side note, the more that you practice some form of meditation or relaxation or self-regulation exercises on your own at home, the easier it will be in a moment of crisis to be able to draw upon that strength. It's like anything else. If you practice it, it becomes like a muscle that becomes stronger with each use. Take a moment to think about the following questions. What signs have you noticed in yourself that indicate you're not feeling calm? Maybe an increase in heart rate or shaking, face feeling hot, clenching your jaw or your fists. Are there specific instances or triggers you've noticed with students or children that make you become less calm? And what strategies have you used successfully or unsuccessfully to calm yourself when you're feeling anxious or angry? So let's talk about some strategies to help students regulate themselves. Remember, because a child's prefrontal cortex is really not well engaged, that's the front part of the logical part of the brain, that's really not well engaged when they are upset or triggered. Reasoning, logic is not going to be successful in the majority of cases. Their fight or flight response is activated. So the number one thing to remember is help them understand that they are safe and are supported. The same things you can use for yourself can help with them, ground them. Ask them to talk about the details of the room that they're in. Ask them to describe some colors that they're seeing, or their sensations of sight, smell, sounds. Try some meditation techniques, deep breathing, muscle relaxation, sensory engagement. Let's help them calm by bringing them over into an area where they can draw, use putty, Play-Doh, even walking, going outdoors if it's safe, to take a walk together and talk through their feelings. Modeling, we talked about that, demonstrating calm. And practicing meditation techniques at other times will help them be able to use those techniques more easily when they're in difficult situations. We've spoken already, but I'm going to stress it again, the tone of voice you use. We want to maintain a calm, even tone. The louder and more out of control they get, the lower, deeper, and calmer your voice needs to become. Out shouting them will not be helpful. Saying, okay, I'm here for you. Let's take a deep breath. We can handle this. And showing that you are not frazzled or anxious in response to their anxiety. What strategies have you used to help calm people who are upset, who are angry, who are agitated? What has worked? What hasn't worked? Perhaps think about a colleague at work, a friend, your own children, a partner or spouse. What has worked for you? What techniques have people seemed to respond to? Sometimes it's as simple as sitting quietly with someone and giving them your full attention and letting them complain, talk about through their feelings, share what is bothering them. We do know often children in the age group of the Traron kids will have arguments with each other. And then it may be best for one person to take each child's individually to help them talk through some of their concerns and complaints before we expect them to be able to talk through it together. Remember that sometimes kids who are acting out are actually trying to provoke a response from you, an angry or hostile or dismissive response. Why? Because maybe that part of their brain that is responding to danger is ready for a fight. And they're looking for a reason to fight or resent you or express their anger towards you. Perhaps this is what this child is used to dealing with, and in some level it feels normal to them. But it can be much more helpful to respond with calm acceptance than with anger or lashing out towards the child. Accept, listen, validate, and you will be halfway towards calming the child. When a child is calm and once again able to engage their prefrontal cortexes, we can then have a more logical discussion. Signs of that a child has become regulated again: calm breathing, they can maintain eye contact, expression of curiosity. Conversation can go two-way where they can actually hear what you're saying and respond to it in a logical way. Obviously, tone of voice. There may be many things that indicate a child is calmer and ready to engage in a dialogue that goes two ways. There may be times when discipline is necessary and consequences, and that's obviously a part of working with children. But remember that the word discipline comes from the Latin to teach. So the goal of discipline should be to teach. Once a child is back in that regulated state, then they are actually in a state of where their brain can learn things. So then is when we say, yep, you were feeling really angry earlier, and one of the things that you did when you were angry was to throw all the cards on the floor. Now it's your responsibility to clean them up, and you can sit with the child and even help him clean up the mess that he made, while saying it can be really helpful to learn from our mistakes. And one way we learn is by picking up and making amends and making things right again for what our bodies did when we were so angry. That might have hurt somebody else or hurt something. And then the child is in a better state to accept that this discipline makes sense and to learn the lesson of the discipline. It does bear repeating that we don't use any corporal punishment, threats, or belittling at the Traron Center, and consequences and discipline really should be discussed on a case-by-case basis with your supervisor. We want all children at the center to feel that you have a positive regard for them and unconditional caring for them. With that, I would like to thank you for paying attention and thank you for your interest in the Traron kids. It's thanks to people like you that the Traron Center can continue to do great work with the kids and have a strong and healthy future as an organization. I look forward to meeting each and every one of you if I haven't done so already, and best of luck to you.